Hello everyone. So this is the first class of Neet PG 2025 GT रिव्यू क्लास। तो इसमें हम स्टार्ट करते हैं आज की फर्स्ट क्लास। तो सबसे पहला क्वेश्चन है सीलियक डिजीज़ में विच एंटीबॉडी इज़ फाउंड। IgA एंटीडी इज़ फाउंड। क्वेश्चन में होगा IgA, IgM, IgG। सो इट इज़ IgA एंटी-TTG. The nerve growth factor alpha beta gamma subunit. Alpha subunit has trypsin like activity, beta has nerve growth promoting activity, gamma has serine protease activity. Then LSD. In LSD poisoning, the question will contain that there was a thing which was in colorful graphics and flashback phenomena was associated. So answer is LSD, lysergic acid diethylamide. Then on MR spectrography, N-acetyl aspartate peak is found. It is Canavan disease in which aspartoacylase deficiency is there. Then question will contain large posterior fossa cyst. It is Dandy-Walker malformation. Then in rapid sequence intubation means we don't have time to wait for intubation, then we don't perform the manual ventilation before the intubation. This step is missing or not done in the rapid sequence intubation. Then DOC for stress urinary incontinence, it's venlafaxine. Then in letharism by Khesri Dal, the enzyme involved is beta oxalyl amino alanine. But the examiner is not asking the enzyme. He is asking what is the cofactor. Sorry, the poison is beta oxalyl amino alanine and the enzyme is lysyl oxidase and the cofactor for lysyl oxidase is copper. Then Alex test for diphtheria. It is Octer-Looney procedure or double diffusion in 2 dimensions. After that, in dermatomyositis, what all you will find? Gotran's papule, heliotrope rash, and perifascicular atrophy will be found. Then is the cancer. In cancer, there is upregulation of muscle-specific ubiquitin ligase. Then full house effect. What is full house effect? When there is deposit of IgG, IgA, IgM and C3, all the antibodies and C3 complement deposited in the glomerulus. It is known as full house effect, which is seen in lupus nephritis. Then linear relation between GLUT and the insulin, seen in cardiac muscle. Then to localize the site of leak in the CSF rhinorrhea. In CSF rhinorrhea, we do the HRCT to localize the site of leak. Then a question will contain moderately elevated aminotransferase prolonged prothrombin time. So it is which is corrected by vitamin K. So its answer is cholestasis, which can lead to the decreased absorption of fat soluble vitamins. Then all the clotting factor increase in pregnancy except the factor 11th and 13th, which decrease in the pregnancy. Then AFP is not elevated in spina bifida occulta. It is elevated in meningocele and meningomyelocele. Then hypervascular central non-leaking scar in the tumor. Liver. Hypervascular central non-enhancing scar means stellate type. Stellate scar is seen in focal nodular hyperplasia, which arise from Kupffer cells. Then the walled clusters of epithelial cells will be found in the meningioma. These are very value points which are directly asked in the questions, and your notes probably do not contain them. That is the main point. Then is the cholestyramine therapy, ileal resection and high calorie diet. They are all the risk factor for dyslipidemia. Then carnitine. Carnitine, it actually requires which vitamin? Vitamin C. Then costovertebral and costotransverse joint are synovial joints. Then placental vascular lacunae. The question will contain there is placental vascular lacunae. Answer is, or placental lakes. Answer is placenta accreta. Management is hysterectomy. Then is the cetirizine. Cetirizine is inverse agonism at the H1 receptor. Then which is responsible for detection of direction of sound? Answer is lateral superior olivary nucleus. Then anemic gene is neuroblastoma, HRAS mutated in the bladder and kidney tumors, KRAS in the colon, lung and pancreatic tumors, c-MYC in the Burkitt lymphoma. Then microfilaria, which is in which there is no nuclei in the tail. Its tail free of nuclei is Eukarya bancrofti. If there are two nuclei at the tail tip, that is Prosia malai. Then nephrogenic systemic fibrosis, it is side effect if sorry, in nephrogenic systemic fibrosis use gadolinium MRI. Then senna laxative special classes is senna laxative, which cause melanosis coli, which is the pigmentation or brownish black pigmentation of the colon. Then syphilitic interstitial keratitis, ground glass cornea. In syphilitic interstitial keratitis, we will found ground glass cornea, salmon patch and the ghost vessels. Then urea and the Krebs cycle are linked by fumarate. Shock, hyperkalemia, hyponatremia, fatigue. Answer is adrenal crisis, because there is decrease in mineralocorticoid, glucocorticoids. We measure the serum cortisol levels in this case. Then Eagle syndrome, it's enlarged thyroid process, difficulty in swallowing will be there, facial pain, tinnitus. Hox B13 gene mutation, increased risk of prostate adenocarcinoma, directly asked. So there is no concept in it, just we have to cram it. Hox B13 gene, prostate adenocarcinoma. Then trichomonas vaginitis. This is very important. In trichomonas vaginitis, the treatment of asymptomatic male partner is necessary. The Brunner grading of lymphedema. In stage 1 of lymphedema, there will be pitting edema only. Then in stage 2, there will be non-pitting edema with positive stemmer sign. This is asked when we can't pinch the skin of the toe. It is stemmer sign and it is found in stage 2. In stage 3, there are irreversible skin changes. So we have discussed around 50 to 60 questions. Sorry, we have discussed around 60 to 70 questions of the GTs. All the which are very easy question we have not added in the mistakes copy, because they are already in the notes. Value points I have added. So this is class 1. Subscribe to our YouTube channel for class 2. Thank you.